We're going to start talking about the SimBaby console operator here. So as I've mentioned before, we have it on pause. So when you're in between scenarios, it's really helpful just to pause it so the scenario runtime doesn't get too long. We find that if it gets above about an hour, sometimes it can get a little spotty. So I've unpaused it. You can see all the kind of vital signs are moving. You see chest rise. Now, if you want to change the patient monitor look, you go up to View. And the first one is Select Patient Monitor. You get 3 waveforms, 4 waveforms, 5 waveforms, big numbers. You can also program your own monitors in there as well. So let's just go, say we don't need an invasive arterial blood pressure. We'll go to 3 wave, click OK. So that gives us the heart rate, the saturation, end tidal, normal, non-invasive blood pressure, respirations, temps. Now, this is what we're seeing here on our computer driver. This is what they're seeing out on the screen out there. So this is as if they have not hooked the baby up to any monitors. If that's part of your goal, that's great. They come in, they hook the baby up to monitors. As soon as they do that, you check these boxes for them so that, well, maybe not so too, so that they will get that feedback in the room. Now, a little troubleshooting thing that you should be aware of with this software is once you hit the blood pressure, it's going to initiate like a blood pressure cuff. You'll get that feedback, but you can't uncheck it. So it's going to pretty much stay there. So that is important when you are setting the scenario and you want them to put all the monitoring on, right? So that's part of your learning objectives. They come into the room, they put the monitoring on, and you're setting the vital signs and everything, and you accidentally check the blood pressure. You've kind of engaged it, and you don't want them to see that ahead of time, but you've accidentally hit it. So there's no way to actually uncheck that one, if that makes sense, because every time you check it, it'll just initiate the blood pressure again. Whereas with the ECG, you can uncheck it, and you can see that it'll go off. It only makes a difference when you're setting the scenario, and if you accidentally hit the blood pressure and you don't mean to, and you want them to actually initiate the blood pressure, you don't want a blood pressure on the screen already, then you need to restart this program. That's the easiest workaround, because all of the others you can check and uncheck and give them feedback or non-feedback, but the blood pressure is just going to engage it. Every time you check it, it'll just engage it. It won't turn it on or off.
So when you say reset the program, you don't mean shut it down and reboot the whole thing, do you?
So you can use the red X to shut it down and start again, or you can also go to start scenario and then just pick a different scenario and reset it that way. This has a nice running timetable, which helps you, but again, if you don't turn the computer down and turn it back on, sometimes it'll just be a long timetable. So I wouldn't use that if you're trying to time your scenarios. I would just have a phone or some other device to make sure you're really accurate with your timing. This is what we call a guided user interface, so it has a lot of information. This is potentially pretty much what they're seeing on their patient ELO monitor out there. If you want to change, we generally work on the fly because, again, as we said, the students bring their own skill and experience and they drive the scenarios. So we tend to work a lot on the fly here. What you can do if, say, you want to change the heart rate is you take your mouse. There's a couple ways to do it. You can hover over it until you get this gray box, and you can use your mouse to scroll up or down that way. You can also click on the number, and when you click on the number, you'll get a scroll bar that you can use your mouse to scroll with, or the touchpad on the laptop. You can also take the number down and type in your own number and hit enter that way as well. The nice thing about clicking on it is you actually are able to get something called transfer time. So if you want, the heart rate's 120 now, if you want it to go to 100 over 20 seconds, you would put in your 100 here, transfer time 20 seconds, and then hit OK, and you would see it go down incrementally over time. So 3 ways to change the heart rate. You can hover over it till it gets to a gray box, and then change it with your scroll tap mouse. You can click on it, erase, and put a new number in, or you can actually use the toggle to toggle up and down, and then use the transfer time. Always make sure that you hit OK, and then cancel if you obviously don't want 200 or whatever. So that goes for all of these parameters. You can just hover over them. The other thing to remember is if you click on the waveform, you can actually get quite a few, probably about 20 different rhythm choices that you can choose from. So you can choose, you can choose whichever rhythm that you want, but you have to hit apply and then OK. If you don't hit apply, then it's not going to happen for you. The other thing that you can do is you can have what they call a running rhythm, so that's what you're in, and then if you quickly want to change on the fly or ad hoc to what's a waiting rhythm, you can have two rhythms that you bounce back and forth from pretty quickly. So you'd hit waiting rhythm and then click whatever rhythm you want. Again, make sure you hit apply and OK. Excuse me. You can see this little toggle button or back here. It's one arrow this way, one arrow this way. That'll help you go back and forth between rhythms. You can also click this one and click on waiting rhythm, apply, and OK that way as well. A lot of the respiration information is on the left-hand side, so you can toggle up the respirations here. You've got breathing pattern on the left, so you've got normal, retraction, and seesaw that you can choose from, and chest rise, normal, shallow, deep, irregular. And also you can turn the torso motion on or off. I tend not to use the respirations on this side as much because I'm always usually kind of over here, and so I just toggle back and forth with what I need to, including the respirations on this side. In the center of the screen, we've got the baby, and you can see that the chest rise is going. We've got the green mannequin, so we know everything's linked up and talking to one another. So I'll just go through all the different features that you can do for this mannequin, and it's pretty simple. You basically hover over the little check boxes, and another box will come up. So the top one would be the fontanelle. The standard is normal, and then if you hit full, that'll give you an indication that the fontanelle's bulging. And then go ahead and click that off to make it back to its normal parameter. Pretty much everything's set as a normal, and then the abnormal you add on. You can just hover over this one. You've got the cyanosis, so that's enabled. So if the saturation drops, if it drops to 55 or 60, you'll actually lose the saturation on the monitor. And if it drops to, I think it's 89, low 90s, you'll get the coloration. I can't really see. So keep that in mind. So just make sure that if you want cyanosis activated, that you have it enabled on your computer. And that's pretty much the standard operating one. You can get tongue edema. So you've got normal, medium, and maximum that you can check on. And again, just hover over it and click on that one. You've got pharyngeal obstruction on or off. And so you can either click it here, or if you know what it is already, you can just click it there and you don't have to hover over it. So it's pretty user-friendly and pretty quick. It just takes a little bit of practice to know what you're looking for, because all the boxes are kind of in a small area. You've got laryngospasm, so you can turn that on off. You can have a left pneumothorax. You can change the resistance, so you can have increased or complete resistance in the lung. You can also have decreased lung compliance. You can check that on. You can have, let's see, pharyngeal obstruction. Turn everything on. And again, if it's a full check, that is fully engaged. Some of them that give you an option of like a low, medium, high. If it's just one bar, then that would be kind of a mid-level. So you can see that that's got just one slash instead of the actual cross. And let's see, you can change the pulse strength, so normal, weak, and absent pulses. Going into vocal sounds, you can choose baby cry, content baby, cough infant, cry infant, which is a little bit louder cry, and then a hiccuping baby. And again, you can adjust the volume as needed here, up or down. You can also hit play, so it'll play once, or you can do it on a loop, so it'll just continually do that. And that's that second one, that's the play button with the loop. You can also stop it if need be. If there's an intervention that they were given and you want to stop the crying, then you can stop the crying that way. Go to normal lungs. So the lungs right now are linked, and you know that because the top box says linked. So if you uncheck the linked box, you can make the left or the right lung sounds different and affect the quality of the sound as well. So for example, the right lung has rhonchi, stridor, wheezes, coarse crackles, or fine crackles that you can choose from, as well as the left. And you can basically choose that from the drop-down menu and then increase or decrease the volume as needed. If you link them up together, then they're both going to have that feature. Now the heart sounds, you can also adjust the volume. You can choose between early systolic murmur, a diastolic murmur, continuous murmur, and a gallop. And so close that out. So once I've hit stridor, so you can see that it's actually stridor showing up on the boxes. So it's another easy check just to make sure that you're in the right mode. It kind of gives you a running tally of everything that's been done to the patient down here in this left box. It gives you a time tally, but also what's been done to the patient. I tend not to look at that very much. There's a lot of information on the screen. I tend to look at basically this piece myself personally. You'll have to find what works best for you, but obviously you're going to be changing the vital sign parameters quite often and then changing some of these other mannequin parameters based on what your scenario is as well. And some of this is already preset when they come in the room. You'll have your initial vital signs already preset. But again, we tend to work ad hoc or on the fly based on what they do to the mannequin, what interventions they do to the mannequin. Any questions at this point?
Are you the sole operator of that, or are there a couple of people in here using that?
So generally the way we work it is there's one person driving the, depends on how many people we have for programs. When we run our anesthetic course, there's quite a few people. I'm the driver of the mannequin, and we have a debriefer or two, usually two debriefers that are watching the scenario. We turn the lights off, and you can see through the room a little bit easier. We also have the video capability. So I'm videotaping on this one, driving the computer on this one, or this monitor here, and usually I'll have someone feeding back to me. Yeah, and usually that's not the debriefer. Usually it's the course director. If there's an extra person that can just directly talk to the computer person is helpful. Obviously that takes a lot of manpower to have that many people in the room, and we're going to talk about simulation roles later in the course. But if you can have somebody that's directly talking to you and telling you what vital signs that you want to change, that's the most helpful. If other people are kind of telling you all different types of things at once, it's not as helpful. Obviously, I know the scenarios and know the direction of the way they're supposed to go, so I can change parameters myself as well, depending on the course. But for the anesthesiology course, they tend to want things.
So the AMAC.
That's the EMAC, yeah. They tend to want things the way they want it, so which is fine. So I help facilitate that one. I'm not an instructor. Yeah. Let's see if there's anything else that I want to show you. I'm just kind of showing you the stuff that I utilize because, like I said, with the other mannequins, or with the mannequins, there's a ton of features. You'll have to suss out what works best for your needs. The information that I've just given you, and hopefully Holly's given you, gives you the basic understanding and the basic start of using it. And then there's other capabilities that are, available to you. But, you have 100% of mannequin, you're probably not going to use 100% of its capabilities ever, at least at one time. We really focus on the methodology. And you can do simulation well with a very low fidelity mannequin and a very high fidelity mannequin. So